Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine. We are at Regenerative Orthopedics and Sports Medicine right now with Dr. Yokel. They are helping people get out of pain and avoid surgery when they can, and best of all, they work with major insurance companies. Dr. Yokel, thank you for having us today.
Absolutely.
I know a lot of your patients that you've already helped are watching right now, but
Sure.
let's talk about some of the people that you help every single day and what you're helping them with.
Absolutely. So I'm not a knee guy or a foot guy. I treat every single body part, from jaws to headaches to neck pain to shoulders to elbows to wrists to fingers, hips, knees, ankles, toes. It's all connected. Sometimes I'll treat more than one spot at a time. I think part of the allure of our strategy is not just saying this is the one issue. This issue became an issue because there was weakness here, there was compensation there. So a lot of time when we're doing these exams, we're finding that core issue that they came in for. I'm also finding the weakness that led to it and sending them to work on it, ideally with strengthening with a physical therapist, or maybe doing some of our treatments to more than one location in order to set that foundation in addition to causing the injury to feel better.
For people that are watching right now that maybe have been treating pain in other ways with shots, we hear that often. They go get a shot, they're good for a little bit, and then it gets bad again.
Right.
You guys are helping people avoid those shots.
Sure. So if you're just giving a shot to block that pain, or you're giving a shot to calm it down, are we really fixing it? You're just kind of putting a Band-Aid and kicking it down the road. And there's times for that. Sometimes you got to have a trip of a lifetime. You need to do what you need to do. But we really want to have an eye to the future and an eye towards strength and stability. I often tell my patients, I don't want to chase your pain when you have stuff all over. I want to chase your strength and stability, and that pain will get better. Trying to help them figure out what is causing the weakness that is causing that pain, using unique and cutting-edge options to try and help change the inflammation in the body, to help change the tension patterns in the body, can really make immediate and fast change for our patients. All of our treatments are done in the office. All of them are outpatient procedures where you're going to be back to major activity within a week or a few weeks. And so for a lot of patients, they don't have the time to spend weeks or months recovering from things. This needs to be part of their regular lifestyle, especially if we can avoid that.
Well, and to not have to go to a hospital, to not have to worry about surgery. When you have patients that come here that were maybe told by another doctor, yeah, we got to do surgery on that, and you say, no, I think we can treat it without. What's that reaction from them when they see they don't have to go through that lengthy process of surgery?
Often pretty excited, sometimes skeptical, always needing to have more information, right? And so one of the main things is we don't want people to walk out and say, I think you said that. I want to go over it with them. I want them to restate the plan to me, really making sure we're on the same page. And we want to make sure I'm doing it with the appropriate option. These days, we have a lot more options besides physical therapy, cortisone, and surgery. And if you don't fit in those boxes, typically you've been waiting for one of them to be appropriate. We have so many different options between loosening tension around nerve, between stimulating inflammation and healing, between loosening up muscle tension. And by doing these treatments and have a coordinated relationship with their other providers, their family doctor, their physical therapist, we can really treat that patient as a whole and get them back on track.
Well, and I love the mission here at ROSM. You really spend a lot of time with each patient, and that's something that in your that's something that's very important, that you actually sit down and really get to know the patient. Maybe people watching right now have gone in, it's in and out, like you said, they don't get a real answer, they don't get to ask the questions because the doctors are just moving through, but you get to spend time with the patients.
It really makes a difference. It really makes a difference in both outcomes, because we have a better idea of what we're treating and why, and the patient experience, to have an idea that, yeah, I think I do understand what I'm doing. So many times they leave the office saying, I think I just signed up for what? I have to show up where? We really want to walk through and make sure they're understanding not just our approach, but what's going on and what are the issues and what are their real options. I never present a patient with just one option. They want me to tell them the best option, I'm going to tell them my opinion. Always present an array of treatment options from least aggressive to most aggressive, why I think this option is right for them, what the next step might be if this works or doesn't work, and kind of what their alternatives are, whether it's me or somebody else, so they can have a complete vision of what that issue is, what their options are to fix it.
I know there are people watching right now that maybe have given up hope. They've put off surgery because they don't want to do the surgery, but they're still sitting there in pain.
Sure.
What's your message to them, and how do they get started with ROSM?
I think the main thing is just coming in and finding out all the options, right? We do accept all major insurances to come in and talk to me and help figure out these issues. We do telehealth visits online if you can't get in here, although really I want to see you and check it out and give you that better understanding. We have locations all around town. All of our physicians and physician assistants are specifically trained with ultrasound. Many of us teach nationally, teaching these treatments to other doctors throughout the community and constantly staying up to date on the new advances in our field.
And you may have a surgery scheduled. Know all your options before that surgery and call ROSM today. Thank you so much, Dr. Yokel.